Hello, Madam Chair and members of the committee. My name is Zach Federico, and I am the Director of the Veterans and Military Affairs Task Force at the American Legislative Exchange Council. Thank you for the opportunity to share ALEC's nonpartisan research and analysis as you consider this legislation to support clinical trials on the use of ibogaine. This issue has significant momentum in state houses across the country. 11 states are considering similar legislation, and West Virginia and Mississippi have already passed it through one chamber with overwhelming support. In December, the ALEC Veterans and Military Affairs Task Force unanimously adopted a similar version as model policy. These efforts represent a broad national movement to support emerging treatments for veterans who are struggling. Unfortunately, traditional PTSD treatments are limited at best. Trauma-focused therapy, the VA's recommended first-line treatment, has an estimated dropout rate of 27.1%. For those who complete the treatment, around 50% still meet diagnostic criteria for PTSD. Second-line treatments involving FDA-recommended medications only achieve remission in about 20 to 30% of patients and often cause adverse side effects. This reality has led many veterans to seek alternative treatments, including ibogaine-assisted therapy, in states where it is not regulated. In many cases, the results have been life-changing. There is no shortage of anecdotal stories from veterans who have experienced complete remission from PTSD and other neurological conditions after a single session with ibogaine. In 2024, Stanford Medicine published a study that found an 88% reduction in PTSD symptoms for combat veterans after a single session. While encouraging, these results demand deeper and more rigorous investigation. These developments have spurred state legislators across the country into action. Since clinical trials on Schedule I substances are expensive and naturally occurring substances like ibogaine have little to no profit motive for pharmaceutical companies, state governments are working together to fund these clinical trials. By joining this national effort, Maryland can help deliver real hope to veterans by advancing responsible, evidence-based research. Thank you for your time and attention, and I'm happy to answer any questions from members of the committee.